if you will, I would like you to take a minute to put both feet on the floor, to wiggle those toes, and to give your shoulders a big shrug. Let out the stress and take a couple of breaths. And as you breathe out, I would like you to close your eyes and put in colour your last experience with the healthcare system. What did you see? What did you feel? And what did you hear? Where were you? And who were you with? I want you to do something that we do in health coaching. I want you to name that feeling. In a couple of words or a word, what was that feeling? Now hold that thought, because we're going to come back to that at the end. And you can open your eyes when you're ready. Our focus is consistently being pulled towards the revolving door of medicine. The New Zealand Herald, 2023. And in Australia, those red flags, we've heard this over the last 2 days, are just as loud. We are living longer, but we are not living better. We are not finding our joy. We can hardly make it to our letterbox. In 2002, an international poll across 7,000 people in 5 countries around non-communicable disease recognised the perceptions of all of those people studied. The majority of them saw non-communicable disease risk as low. Public awareness is so poor. And the World Health Organization in May 2023 published a report that talked about the best buys in non-communicable disease and combating this. I believe that giving all healthcare professionals a coach approach mindset is a cost-effective best buy. I am a proud PREKURE health coach. I am also a patient at risk clinical nurse specialist. What that means is I work alongside deteriorating patients. I work to prevent early organ failure and to be at resuscitations, to get in there and make things better where I can. But this is end stage. Now, when I was training as a health coach, I had a real aha moment. I was called down to the emergency department alongside the resuscitation team, and we did what we do best. We looked at ABCDEs for a 70-year-old chap that was hypoxic. He didn't have enough oxygen going around his brain. We couldn't solve the problem. He needed to have a mask on him to get more oxygen. It was called BiPAP, and we knew this. And he was flailing, he was distressed. We were not winning. I thought about my health coach approach, and I whispered in his ear, "What's most important to you right now?" Something we don't normally do. And his little spark came in his eye, and he said, "My cat." And with that, we were able to establish that he had no next of kin. His neighbours were his family, and we were able to ring them and get his cat sorted, and he happily took that mask. The health coach approach is all about seeing the person, not the problem. Post-World War II, we built our health system on predominantly men coming back from war. We looked at what is wrong with them. We were fixing them. We were fixing their physical. The health coach approach looks at what's right with people. It's based on positive psychology. What are their strengths? What do they do well? What gives them confidence? We are at the pointy edge, we know this, we've talked about it, of chronic illness. In my PAR role, I work across 2 hospitals in every department, in mental health, on the wards, in coronary care, in ED, in ICU. And I feel that over 34 years, I have had in critical care medicine a bird's eye view. And this picture and this view is Mexico City from the air, the chaos, the organised chaos. I thought it was really appropriate. And what do I see? I see incredible, dedicated, caring and talented healthcare professionals out there who are time poor, under-resourced, burnt out, and quite frankly, they are sick. I see end-of-life care that is distressing and tragic. It is quite common for me to go to a resus where I'm the first person there, someone is in cardiac arrest, and there is no resus documentation. I'm obliged to start CPR. That is distressing for families. It is also morally distressing for health professionals who consistently have to watch this unfold. We wonder why they're burnt out. When I do healthcare assessments, and I'm also time poor in my role, I talk to people that are moderately to severely chronically ill, and they say, I'm healthy, I'm absolutely fine. Their perceptions are that their pills have fixed them. The insight and awareness is poor. We need better public awareness. We need a megaphone. I see people who are highly comorbid going for complex surgeries, who have not had the opportunity to prepare for the big day with simple skills and tools. Then they develop multiple complications and reduced functionality from where they started, and a lifetime of medical appointments. It's tragic. I also see incredible specialist units that are, really cost heavy. They have state-of-the-art treatment, and they are pressured to take people that have poor quality of life and functionality. I believe that a best buy is a health coach approach and mindset by all health professionals. We heard about GP practice, the amazing combo of health coaches and GPs. I believe this should be across all healthcare. I want to see the coach approach that brings back humanity to medicine. We walk alongside the person seeking wellness to be curious and not judge, to uncover their values, their beliefs, and what is most important to them right now. We bring in the tools and skills of transformative coaching, and we find out what really matters to them right now. That recognises that not one size fits all, allowing our clients to self-experiment, to do that on their agenda. They're driving the waka, we are steering the and paddling in time. Change is messy. We know that about habit change, and it is not linear. We need to walk alongside our clients and meet them where they are at right now and understand things from their life world. Te whare tapawha, so important to see that whole person. Sometimes on my PAR rounds, and a commonality will be, I don't have time, but I always ask one power question. And I just think, I often see these 30, 40-year-old men who are moderately to quite highly chronically ill, and I'll ask them one question, what's your biggest concern? They cry. They've been in hospital for 3 weeks. No one has ever asked them a question where they can actually be heard. Kelly's story. I believe that we should use simple techniques. Kelly's story happened to me a couple of weeks ago. I was on my paramount on the wards, and one of the senior nurses asked me, can I help? And she was having a panic attack. She was really struggling. They'd been giving her lorazepam, a sedative, for over 24 hours. So I went into the room and I said to her, would it be okay if I try something? So I asked permission. When your client, or I hate the word patient too, Jana, I'm with you on that one, when they own the problem, they're more likely to have some belief in solving it. So ask permission. I took her hand and I taught her box breathing. And we slowly breathed together. And as she breathed out, I taught her an ACT technique, acceptance commitment therapy. And together, we helped her put those unhelpful thoughts onto a leaf on a river and gently float away. The nurse behind me had the lorazepam ready, and within a few minutes, she had calmed. Her heart rate, her blood pressure, all being monitored, and her rest rate had all gone down. She looked up and she said to me, no one's ever done that. I could use this. Simple, simple techniques. ACT is incredible. We all have talked about the pillars and the PO of lifestyle medicine and how amazing they are. We must ask permission to share these. We must make our clients lead. They will be then more invested in the solution. Science is going to change. We must change with it. Stress adaptation. We must use metaphors to reframe how our clients think about stress. They must train their muscles against strength in a gym. Habit change is messy. Share that with our clients and be in with patients and on their agenda. Let's meet them where they are at. Soana was an incredible student on the Pacifica medical cohort at PREKURE. She says it best. We have talanoa, we have conversations, which are the most empowering conversations I've ever heard. And Soana has agreed for me to share this. Soana, she was a health navigator and went into people's houses in the community. She still does with her new health coach approach. And what she said in talanoa is, I now go in with fresh eyes. I don't see the chaos anymore. I don't see the grime. I see the person, not the problem. I ask questions curiously. I leave space. And I am a strength spotter. I find their strengths. I champion them and I help them to move forward positively, little step by little step, from where they are now. I add in science with permission and I find out what that means to them, and we move forward together. Very powerful. Depth and courageous conversation is the keystone to choice point and outcome. It is time that we all accept that our Paleolithic brains will always see the negative. They will always crave things. There is so much factory food, omnibus of Netflix, and Uber anything you want these days. And it's really easy to make the unhealthy choice out there all of the time. It's attached to our hips, those phones. I say we still have choice. we have choice to put our energy into a best buy, which is cost effective, and that is the health coach approach.